I too am really pleased to be able to stand today to talk about the budget. A typical budget in any household would look at all the costs to be accounted for and weigh up the essentials alongside of the luxuries, provide a plan for how best to pay the bills and perhaps deal to the debt. Our budget is no different. Except for Budget 2011, it's all about essential spending with no room for luxury items. The essential items that I want to focus on budget lines associated with rheumatic fever, family violence and sexual health. I define these as essential items in that they are intimately and directly associated with the health and well-being of a family, and yet too often they are the issues that have been associated with poverty, with prejudice and with pressure, and consequently haven't received the attention that they warrant. Throughout all of our decisions in Budget 2011, we have tried to advocate for those who are the most vulnerable, those who need it the most. And I have to say that one of the most promising pieces of policy advice that I have ever seen from Treasury is John Whitehead's swan song statement on living standards, where he declared that tighter budgets require an even greater focus on making sure that resources go to those who most need it. The Living Standards Report addresses the need to improve the living standards of those who have had a poor long-term outlook. It is a theme that is dear to my heart. The Māori Party from our first day in this Parliament raised questions about the quality and the efficiency of the annual spend across the state sector. Is it getting to those who need it the most? Is the trickle-down theory working out for the people who should benefit? Is there a better use of limited funds so that we actually make the difference that we seek? It is these questions that have motivated us in Budget 2011. In the family violence field, all the evaluations of the It's Not OK campaign were telling us that it was not just enough to have raised awareness. Families and friends wanted to know exactly what they needed to do to get help. The research told us that people felt the television ads had helped them to understand that violence is unacceptable and change is possible. Budget 2011 builds on that research and is targeted to help create the long-term changes that are needed to prevent violence from reoccurring. I have to say that it's not been universally popular, but I have no regrets about our decision to focus on frontline services that are focused on restoring family safety and family well-being where the violence has occurred. And while I can appreciate the concerns of providers where program funding has been cut or potentially they stand to lose workers as a result of the new direction, at the end of the day we have to think of the bigger picture, and that is of course what we can do to protect our families from harm. Our greatest campaign must be our fight to support families, to bring back the balance in their lives and to be violence-free. The great bulk of the funding is now going into Family-Centred Services Fund, which encourages flexibility for families to achieve longer-term transformational change in their environment. In the current climate, funding is limited, and we have to make sure that every taxpayer dollar is invested where it will have the most impact. There was no new funding, and so I wanted to channel the $11 million that I have responsibility for to services at the front line, so that families in crisis are kept safe and are supported to be resilient and strong, and I make no apology for that. The focus of the funding in family violence is also to encourage providers to work together to reduce service fragmentation, duplication and gaps, to provide more effective frontline services that better respond to local need. There are very much the same factors that influenced me in redirecting $1.5 million of funding spread across thousands of groups in 37 various regions under the mantle of the Community Organisation Grant Scheme. We all know that we have communities that have significant issues with little or no funding. Funding has been small in the past, and this does little to create sustainability. So rather than the widely dispersed lolly scramble approach, which gives a little to a lot, I wanted to do something different. Be a bit bolder, place our trust in communities to address their own issues in an approach which encourages existing groups in a region to work together for the good of the community. When it came to our initiatives in health, what we looked for again was what would be the greatest gain within there. Top on my list was doing something about the appalling rates of rheumatic fever that has come to light. And no government could ignore rates of rheumatic fever, which are now 14 times higher in New Zealand than in any other OECD country. We should all be ashamed of that. And although I am sure that there will be questions at some stage about how we got to this point, especially after years in which we should have been addressing these significant issues, mainly in housing, mainly right across the social sector, we have not done that, and my focus is firmly fixed on what we can do to make a difference, not what we haven't done. The concern for us in the Māori Party is to observe that there is a large disparity between ethnic groups, and it appears to have worsened over the past 20 years. The mean incident rates for Māori and Pacifica children aged between 5 and 14 are now between 20 and 40 times higher than for other New Zealand children of the same age. This is catastrophic when you consider the whole way in which rheumatic fever impacts on our children, the long-term impact that has, and certainly for the family. And yet, this is an entirely preventable disease that can have serious consequences for children during childhood and throughout their whole lifetime. And so the $12 million investment announced in this budget will support a number of initiatives such as increasing frontline community staff, school-based sore throat clinics, and a range of research and training programs for health professionals and community health workers. I think there is a really important message here also for GPs who are at the front line of community health, that when a child presents from a Māori or Pacific whānau, that they should be prescribing amoxil immediately rather than wait, test, and then that child doesn't come back for treatment. They must treat it right there at the point of contact when the family brings their child in. The other announcement I made in health was to target the particularly high-risk groups that need it most in the sexual health and reproductive health arena. And so we've put a focus on a range of areas addressing the incidence of chlamydia in rangatahi, supporting African communities, expanding health promotion initiatives aimed at reducing the stigma faced by people living with HIV and AIDS. There are other highlights that I am really proud of in this budget. $6.5 million to expand family-based literacy programs to all decile 1, 2 and 3 schools. Thank you, Minister Tolley. Funding of $3.3 million for community-based initiatives to increase digital literacy and connection. And of course, the major highlight, the investment of an additional $30 million in whānau ora. This investment confirms and validates the momentum and the potential of the whānau ora approach in uplifting whānau to increase their capacity and capability and to reduce over time their reliance on government-funded services. What we know is that several hundred whānau, including several thousand individuals, are already engaged in planning and development at the whānau level and are connecting to existing service delivery and increasingly to the whānau ora service providers. Our whānau are the greatest source of our strength. Their needs cannot be put aside as a luxury item for another year. The investment we have made in placing whānau ora on everyone's agenda could not have come soon enough. So today, as I said when I started, I am really proud to stand and support the budget of this government. Kia ora.
Speaker.
The Honourable Stephen Joyce.